Good morning. I am Dr. Srikanth Nambudiri, Chief Medical Officer, Sridharam Ayurvedic Eye Hospital and Research Center, Kuthattukulam, Kerala. Today, we'll speak about the disease called glaucoma. As an introduction, glaucoma, it's globally around 2 billion people are suffering from some sort of visual impairment. Half of these cases are attributed to preventable causes. According to WHO, glaucoma is the third most common reason for preventive blindness. What is glaucoma? To put in simple terms, glaucoma is often linked to a buildup of pressure inside our eye. The eye always needs a certain amount of pressure to maintain the shape and size of eyeball. However, increased pressure in our eyeball, called as intraocular pressure, this can damage our optic nerve which sends the images to the brain. If the damage worsens, glaucoma can cause permanent vision loss or even total blindness within a few years. Now, what are the common signs in glaucoma? The interesting thing is, in majority of the patients, there is no symptom at all. In fact, 40% of your optic nerve can be damaged before you notice any loss of vision. In very few patients, glaucoma may present with symptoms like mild headache, eye pain, sometimes redness in eyes, or severe eye pain as in uncle-closure glaucoma. A reduction in contrast between objects and their background, night vision problems, and loss of field vision. But the point to be stressed out here is that the majority of patients will not have any symptoms at all. Coming to the point that how the glaucoma affects our vision. The glaucoma initially damages the peripheral or the field vision, leading to a condition called tunnel vision, which looks like we look through into a pipe. Central vision may not be affected until in a larger stage. See, now I am a normal man, I am looking straight. This is my field of vision, my side vision and superior and inferior vision. This is about the field vision which I am going to speak about. See, in a normal man, I can able to see like this. If suppose a man affected with glaucoma, the field will be reducing from superior to medial or inferior to medial or from the sides and leading to a stage called tunnel vision, which will be looking to a pipe plane. And ultimately, that can be affected to a condition called complete loss of vision. See, that's what, when the field affects like this in the starting stage or initial stages, since that patient can see the straight vision, it helps to capture all the images there in front of his eyeball. But since it is affecting towards the central, then only people will understand that there has a problem over eye. That is diagnosed as glaucoma. So now, how can we diagnose the glaucoma? As I said earlier, there is no other clinical symptoms which is noticed in the initial stage. When you approach a doctor, they will check your eye pressure by using an instrument called tonometer. Next, if the doctor suspects that or the patient says that if they have any of the field vision loss, the next option, objective parameter which is used is for checking the field vision by using a Humphrey Visual Field Analyzer. And in that, if we find any vision loss from above or below or for any sides, the vision field can be noticed. And sometimes they use to dilate the eyes. And the third confirmatory investigation is to examine the optic nerve head by using an instrument called OCT. Now, what are the risk factors of affecting glaucoma? See, there are a lot of reasons behind this thing. But a particular reason telling about how this has affected a particular person, it is a bit difficult. In most cases, it's of hereditary cause. And apart from that, other systemic diseases like diabetes mellitus can also lead to this. And age is also a major factor in this. In the present scenario, we all are dependent on different types of gadgets as a part of our study and profession. Due to that, this can lead to the other diseases like dry eye syndrome, computer vision syndrome, these all things can again lead to the disease called as glaucoma. This is brief about the disease glaucoma. Of course, medically there are a lot of other classifications in this. Ayurveda has different medicines and treatments to control the intraocular pressure. The three segments which are explained in the treatment of glaucoma in Ayurvedic science is, the first is to control the intraocular pressure. Next is the optic nerve damage, so that the further field of vision loss can be managed. And the third one is neuroprotective. The present condition of the vision and the quality of vision should be maintained. Now, let us conclude. The glaucoma diagnosis can be scary, but early the diagnosis, better the prognosis. We suggest an adult more than 40 years of age or having a history of history of glaucoma should go for a routine checkup to diagnose glaucoma every at least 1, 2 or maximum 3 years.